So, today, we're diving into a really critical topic. It's a rare but incredibly dangerous complication that can happen after one of the most common surgeries in the world. It's called a cesarean scar ectopic pregnancy, and it is, without a doubt, a do not miss diagnosis.
All right, let's start with this number, 32.1%. What is that? Well, that's the percentage of all births in the US back in 2021 that were delivered by C-section. It's an unbelievably common and often a totally life-saving procedure.
But here's the thing. What happens when the very scar that's left behind from saving one life becomes a danger to the next pregnancy? Yeah, this super common surgery can create a rare but really serious risk. So the big question is, what is it?
To answer that, we've got to talk about the scar's dangerous secret. We're talking about a condition called a cesarean scar ectopic pregnancy, or CSEP for short. So what in the world is that exactly? Okay, so a CSEP is an early pregnancy that, instead of implanting in the main, healthy, strong part of the uterus, implants directly into the scar tissue from an old C-section. And here's the really crucial point. It's inside the uterus, but it's in a dangerously wrong spot. Here's a great way to think about it. A healthy pregnancy is like building a house on a super strong, solid foundation, right? The thick, muscular wall of the uterus. But a CSEP? It's like trying to build that same house on a weak, flimsy patch of drywall. That scar tissue is fibrous, it's thin, it just wasn't made to handle the incredible growth and blood supply that a pregnancy demands. And this slide just shows you the difference perfectly. Look on the left. You see a normal pregnancy nestled up high in the fundus. That's the strong, muscular top part of the uterus, exactly where you want it. Now, look at the image on the right. That's a CSEP. You see how dangerously low the pregnancy sac is. It's embedded right where that C-section scar would be. So the million-dollar question is, how do doctors spot this thing before it turns into a total catastrophe? Well, it's kind of like a medical investigation, using ultrasound to hunt for very specific clues. Let's take a look at the evidence. One of the biggest clues is something called the crossover sign. So if you imagine drawing a line straight down the center of the uterus, a normal pregnancy would stay neatly behind it. But look here. You can see how the pregnancy sac has literally crossed over that line, bulging forward into the scar. That is a major warning sign that it's in the wrong place. And here's another critical clue. The thickness of the uterine wall. You can see the pregnancy burrowed into the scar, and that layer of muscle, the myometrium, between the pregnancy and the bladder is just terrifyingly thin. I mean, we're talking sometimes less than 2 millimeters. A wall that thin is at a super high risk of just rupturing. Now, I want you to take a look at this. On a regular, standard ultrasound, a doctor can see that the pregnancy is way too low. And that's an immediate red flag, right? It's definitely a cause for concern. But this image, it doesn't even begin to tell the whole story. But then they switch on the color Doppler. And wow, suddenly the true danger just explodes onto the screen. All of that wild color, that's a massive, chaotic, totally abnormal network of blood vessels. It's what doctors call enhanced vascularity. The pregnancy, because it's in such a weak spot, has tapped into major arteries, creating this ticking time bomb that could lead to catastrophic bleeding. And from that point, a CWEP can pretty much go down one of two very perilous paths. If it grows endogenically, it grows inward, into the main uterine cavity. The danger there is that the diagnosis gets missed, leading to a nightmare scenario called placenta accreta spectrum and massive bleeding at delivery. If it grows exogenically, it grows outward, towards the bladder. And that risk is even more immediate, uterine rupture and early. Both paths are incredibly dangerous. So all these clues, all this investigation, it leads to one huge question. Why does this matter so much? What are the actual high stakes of missing this diagnosis? Well, if a CSEP is missed, or even if the treatment is just delayed, the consequences they're severe. We're talking massive life-threatening bleeding, the uterus literally rupturing, or the placenta growing so deeply into the uterine wall that it can't be removed, which is placenta accreta spectrum. All of this can lead to losing the ability to have more children through a hysterectomy, and in the absolute worst cases, it can be fatal for both the mother and the fetus. And this is not just some theoretical risk. Look at this picture. This is the tragic but life-saving result of a missed diagnosis. After this patient had multiple scans where the CSEP wasn't identified, she needed an emergency hysterectomy at just 14 weeks pregnant, all to control the bleeding and save her life. It's just a stark, powerful reminder of what's at stake.
But this story does not have to end in tragedy, because there is a resolution, and the absolute key to preventing these horrible outcomes is knowledge and, most importantly, early diagnosis.
So here it is, the bottom line. When a CSEP is caught early, we're talking in the first trimester, it can be managed safely. Doctors have treatments that can resolve the pregnancy, stop those catastrophic outcomes from ever happening, and in many cases, preserve a woman's ability to have children in the future. Awareness really is the first step to a safe resolution.
And that leaves us with a really vital challenge. As C-sections continue to be common, it's likely we're going to see more cases of CSEP. So how do we make sure this do not miss diagnosis is never missed? Well, it comes down to awareness for both doctors and patients. Understanding the risks and advocating for careful, early screening, that is the key to turning this dangerous secret into a preventable outcome.